The next section, Section 5, will look thoughtfully at employee prevention strategies. Employee involvement is an essential piece of a workplace violence prevention program. Employees' involvement should include the following: know and practice the policies in their organization's workplace violence prevention program, attend safety training programs, participate in safety and health committees as well as security committees, alert appropriate staff to any concerns, and report all incidents through known reporting procedures. Another key piece of employee involvement should include dressing for safety. Long hair should be tucked away so it can't be grabbed. Avoid jewelry that could be grabbed. Wear proper fitting clothing. Too tight might restrict movement, too loose could get caught or grabbed. Use breakaway safety cords or lanyards if wearing one around your neck. This is not a complete list, simply ideas to begin the process of reducing hazards. Be aware of your work environment. Every work environment has risks, some of which cannot be modified. However, take the time and review areas that can be modified to make them safer. Some items to consider might be room configuration, lighting, hallways, workstations, entrances, and exits. Be aware of changes to your work environment. These items might include weather, patient load and morbidities, staffing levels. This is essential during meal times, transporting patients, or shift changes. Noise levels, floating to alternate work areas. Be sure to note exits and emergency phone numbers whenever working in a new environment. Patient behavior. The majority of violent behavior is preceded by warning signs. Verbal cues could include speaking loudly or yelling, swearing, a threatening tone of voice. Nonverbal cues might include basic physical appearance, arms tight across the chest, clenched fists, breathing heavily, agitation, a terrified look, a blank stare, a sudden change in behavior, or an indication of alcohol or substance abuse. Violence risk assessment tools. Risk assessment tools provide a standard in evaluating an individual's risk for potential violence. The Center for Disease Control has many documents that are helpful with the implementation of a workplace violence prevention program. Be mindful of your responses. Pay attention to your instincts. This is very important. Communicate effectively. Be extra cautious when fatigued. Recognize your own cultural heritage, behaviors, values, and possible biases. These are some additional pointers for non-institutional healthcare settings. Ensure a background check has been done on patients and possibly family members. Work with another team member if entering a potentially dangerous situation. Always have a cell phone. And be certain someone knows where you are. Have a code word to let someone know you're in trouble.